Hey guys, and welcome back to my channel. So if you've been following along in my journey at all so far, we are now in week 36, aka the 9th month of pregnancy. So in the last 4 weeks here, we're in the home stretch. So what I'm going to do today is I'm going to give you guys an update on how things are going as far as symptoms and other things, and then I will also share with you my birth plan so you guys get an idea of what that looks like. So I hope you enjoy it. So as always, I will start off with symptoms. Being that we're in the 9th month of pregnancy, if you've ever been pregnant before, you know this is one of the harder months only because of the size of the baby and your belly. So everything's been growing. Not sure how big exactly she is, but she's been growing steadily, so that's good. And so has my belly. So along with that, I have experienced some difficulty breathing, only because she's pressing on my lungs. So a little shortness of breath, more than normal. Definitely trouble rolling over, especially in bed. It takes quite the effort to get from one side to the other. And if you've been pregnant before, you know you have to sleep on your side. But if you sleep on one side for so long, your hips go numb. So then you got to switch to the other side. It's just a whole ordeal. So been dealing with that. And then also just kind of slowing down a little because of all the extra weight on my hips and my back and the shortness of breath. It keeps me from going as fast as I'd like to go. Yes, I'm still being active and everything, but it's still hard to do some things. So if I do go for walks, they're shorter and just maybe more frequently throughout the day. And then I have experienced a little bit of cramping and pain, like round ligament pain, as the baby continues to press downward. And then some continual sciatica and a little bit of acid reflux. Luckily, I haven't really experienced any heartburn, but I have experienced acid reflux, and I noticed it's only with certain liquids or if I overeat. So I just try and keep to small meals throughout the day and not drink too much liquid, especially with my meal, because that causes it to come back up. So that's pretty much all that's changed as far as symptoms here in the past couple weeks. But I do want to share some updates with you because it has a lot's been going on, especially as we kind of wind down here and get ready for her arrival. So last week I went to my I was 35 weeks. I went to my 3rd trimester consultation with the OB. Because as you know, if you've been following along, I'm having an out-of-hospital birth at a birthing center. So one of the laws in California is that you can do that as long as you meet with an OB during your 3rd trimester and he approves you for an out-of-hospital birth. And the reason he has to approve you is if you are high risk, you cannot give birth outside of the hospital. So we went last week, talked to the OB, met him. He's a really busy guy because he's the chief of staff over at his hospital. But after we waited about 2 hours. We finally got to see him. He is an excellent doctor, very attentive, very good bedside manner, looks you directly in the eye, and very knowledgeable. So just having that peace of mind, knowing that if anything does happen or if I do get transferred to the hospital, that I'll be in his hands, is very reassuring. He was just very polite, very professional, and he also just gave me the go-ahead and then just gave me some pointers on labor, on if labor's not progressing, what are some signs and then what to look for, and so that I don't spend 40 hours in labor and then just end up getting a C-section anyways. So he just gave me some good pointers and tips for that. And we also, while we were there, because we had to wait so long, we went ahead and registered at the hospital. So this is in San Dimas, which is not near us, but it's not too far from the birthing center. And so if I do get transferred, that's where I will get transferred to. It does seem like a good hospital, so I feel like I will be in good hands if that situation does come up, which hopefully it doesn't. And then as far as like growth, Weight has pretty much leveled out. I might be gaining about a ½ pound a week, but nothing too crazy right now, so that's good. Definitely just feeling all the weight gain that I've gained up until this point, so I'm glad it's kind of slowing down. Still trying to be as active as possible. I'm doing my EMOMs, every minute on the minute workouts, so about 30-minute workouts. I try to do them 5 to 6 times a week, so still trying to stay as active as possible, walk when I can. It has been raining almost every day, so haven't been able to get outside and walk, but try to walk with the treadmill at the gym, stuff like that. And I did start taking a course called Taking Kara Babies. Only reason it's called that is because the lady who made it, her name is Kara, and she is a labor and delivery nurse, and her husband is a pediatrician. So she's really knowledgeable. She has 4 kids, and the whole course is designed to help you develop good patterns right up front with your newborn for sleep. Because especially as a new mom, we don't know what to expect, and we are more likely to kind of be helicoptery and jump on every little fuss and whine, and really just make our jobs more difficult. So she talks about, especially in the first 4 weeks of life, establishing good sleeping routines. Obviously, in the first 4 weeks, you're not going to get a set schedule, but the idea is by the 4th week that the baby is sleeping at 4 hours straight through the night, and then continues to grow as the baby gets older. And the only way to do that is to establish these good habits right from the get-go. And that involves feeding, sleeping, and playtime. So there's a lot involved, and I'm really happy that I took the course. I just found her on Instagram. She's just a mom trying to make a living, and it's super interesting. I do recommend it to anyone who either is a new mom or is already a mom and is struggling with their newborn not sleeping through the night. So great course, highly recommend it. So besides that, yesterday I did go to my 36-week checkup at the birthing center with the midwives. Everything looks good, heart rate's good, weight's good, bumps growing. They did prescribe to me, it's called evening primrose oil. Now you may have heard of that before if you were pregnant before. But basically they prescribed it to me because last year I did have a surgery. I had a colposcopy. Basically they removed precancerous cells from my cervix, and when they do that, they do often scar tissue forms, these like lumps of scar tissue, and when you go into labor, if you have those scar tissue lumps, it could slow down or potentially halt labor. So the idea of the evening primrose oil is to kind of soften the cervix so that the opening up or the dilation is much faster. So they prescribed to me 2,000 milligrams a day. So I'll be taking that from now up until the time of delivery. So if you want to know more about that, I highly recommend you do some research on it, because there is a lot of good research on it. And it's usually only recommended by midwives as kind of like a natural preemptive strike, because the whole idea behind the midwifery is to be preemptive, not reactive. So you want to prevent the problem before it happens instead of trying to fix it once it's there. So if you want to know more about that, go ahead and research it. And then the baby, little Isabel, is still posterior. But that's okay because she's still really small. She's probably only about 5 pounds, so she still has a little bit of room to move around in there. But they're not too worried. I'm continuing to do my exercises, and so she'll flip around, I'm sure, before go time. And then Monday, I did get my first prenatal massage. As part of my birthing center package, I do get 3 prenatal massages or postpartum. So I chose to do one now. I'm gonna try and get one in before the delivery and then one postpartum. And it was awesome. I highly recommend it to any pregnant women. Obviously, if you've ever gotten a massage before, a prenatal is going to be different. It's very intimate and can be uncomfortable for some people, but they really work on all those problem areas that as pregnant women we struggle with because of all the extra weight we're carrying and all the strain on our bodies. So it's just a full body Swedish style massage, very relaxing, whole hour of just you relaxing, breathing, and getting ready for labor. So also, since I'm in the 36-week mark now, next week will mark 37 weeks, which is considered preterm. So if I do go into labor and deliver next week, everything's safe, everything's good. If being that I'm giving birth outside of the hospital, there's a window that I have to stay in, and that's 37 and 42. So they can help me deliver between 37 and 42. Anything before or after that, I have to go to the hospital. So everything should be great if she comes next week or she comes in 5 weeks. So not worried about it, but that's good to know that we've made it this far. And then with that, we have went ahead and picked out a 2-bedroom to move to here in our same apartment complex so that we can have extra room for when she arrives. Although the hubby will be in the Navy, it'll be really nice for me to have that nursery, have that extra space while he's away, and then, you know, in case guests stay with us, things like that, we'll have that area. So we're really excited to get the extra space. We're starting to get really crowded here in the 1-bedroom with all the baby stuff. So it is really pushing it as far as the timeline, but it'll be okay. We're not worried about it. We're happy it's in the same complex, and our apartment manager's son has already agreed to help us move. So everything should work out great. So we're really excited for that. We started packing already, all the unwanted things, so that especially as we get closer and closer, all Johnny will have to do is just pick the stuff up and move it. So it shouldn't be too difficult. We're just really excited for this next venture. And with that, we also went ahead and installed our car seat in my car so that we're ready in case I go into labor anytime. And then I started to pack my labor bag for the birthing center, so we're all ready for that as well. But my goal for the next few weeks is just to practice a little more the breathing techniques and getting ready for labor so that when it does come, we're a little more prepared, because as I've been saying, we're having the out of hospital birth, so no pain medication means we need to deal with the pain in other ways. So there's a lot of things you could do that I talked about in my natural pain remedies video, if you want to go back and check that out. But that's what I'll be practicing over the next few weeks to make sure that I'm ready for when that happens. And then the last thing I wanted to share with you guys is my birthing plan. Now, if you are pregnant or have been pregnant before or are thinking about getting pregnant, you should always have a birthing plan. And a birth plan is simply, what do you want to happen for your birth? What do you want to go down? Who do you want to touch you? Who do you want in the room? What medications do you want or not want? What treatment do you want or not want? So basically all your needs and desires need to be written down and discussed with your provider before the date comes so that you guys are on the same page. So I'll go ahead and share mine with you. This is for me personally. This is what I want. This is what's gonna work for me. This may not work for you, and that's okay. So just, if it helps, great. If not, that's okay too. So my goal for my birth is to have a natural, unmedicated birth while being informed and allowed time to make decisions during labor and after birth. So that being said, anything can happen during or after. So if emergencies come up, decisions need to be made, etc., etc., I would like to be informed and be able to make those decisions. So I then broke it down. There's only 3 sections. You want to keep your birth plan to 1 page. Anything more than that, people are more likely not to look at it. So first section, I'll talk about labor since that's what happens first. I would like my water to be broken on its own. I do not want them to break my water. Reason being, you're at less chance for a C-section or for infection if you let your water break on its own. Breaking your water too early can cause infection because you don't go into labor early enough, or it can cause other complications. So I would like my water to be broken on its own. I would also like to labor at home for as long as possible. So first stage of labor is obviously just contractions. Nothing else is going on. So I would like to do that at home in the comfort of my own home with my own home remedies as long as I can before being transported. This will also help me remain more calm, keep my cortisol levels down so that labor can progress as needed and not slow down due to stress. I would also like intermittent monitoring of the baby, fetal monitoring, instead of constant. Constant monitoring, when they hook you up to the constant monitoring machine, can just lead to unnecessary panic. Like, say the baby's heart rate changes, they could like panic, extremely unnecessary, get you excited, slow labor down, cause all these problems for no reason. So just periodically checking on the baby's heart rate is more than enough. And then they do, during labor, normally they check, usually every hour, to see how dilated you are. So I would like them to do limited exams as needed. Yes, they need to do them. I understand that because they need to check you for dilation, but too frequently, not only is it uncomfortable, but it's just unnecessary. And then once at the birthing center, I would like to be free to move around and try different positions, which is not a problem because we get our own private room. And upright position is the best, especially when it comes to pushing due to gravity. So I would like to move around, try the tub, try the birth ball, try the bed, try everything that feels right in the moment. I would also like to be free to eat and drink as necessary because you can't do a marathon without fuel. So you expect to go into 24 hours of labor without eating or drinking? Not gonna happen. So I would like to be able to snack or drink, at least electrolytes as needed. I would like my husband to be with me at all times. You just need that constant support. I don't want a lot of people. I don't want anyone else there because I don't need people bossing me around and making it stressful. I just want my husband there, encouraging and supporting me. I would also like music to be played during the labor, help me get out of my head. I would like my husband to take pictures as needed. Obviously nothing too graphic, but I do want to document this because this is huge and it's special, and I want to be able to look back and remember how brave and how strong I was and how I overcame this. I would also like mild aromatherapy in the room. So at the birthing center, they have essential oil diffusers, and what it does is it calms your nerves and calms your mind. So I've requested certain scents, and I would like those to be diffused mildly throughout the labor. And then comes the birth. So that was labor, this is birth. I would like to push at will, which means that I don't want someone telling me when to push, because pushing sooner than you're supposed to increases the risk for a tear, especially a severe tear. And then I would like my husband to be able to catch the baby with the assistance of the midwives. So he's gonna help catch her, and then they're just gonna help make sure everything goes safely. And then after she's born, I would like the umbilical cord to completely drain before being cut, because the umbilical cord is full of oxygenated, stem cell full, beautiful immune system boosting blood, and if you just cut it, you lose all of it. So we're gonna wait until it drains, unless of course there's an emergency, and then we'll cut it. And then also we'll be doing skin-to-skin contact after birth. That helps with breastfeeding because the baby starts to get to know your scent. If you are wearing clothes or whatever, it could cover up your scent and make breastfeeding more difficult. And then I would like nursing only. Don't want to confuse the baby with any kind of bottles. And then there's 2 treatments that are given typically right after birth. There's the vitamin K shot, which I would like to be given The reason why is because babies are born with a vitamin K deficiency, and the vitamin K shot is designed to prevent a brain hemorrhage. So if it means saving my baby from a possible brain hemorrhage, yes, please give that to my baby. And then the other one is an eye treatment, which is with a really strong antibiotic, and I have denied that one because that one is only for mothers who have tested positive for STDs. So I will not be getting the eye treatment. And then I would not like my baby to be bathed after birth because the protective coating that is surrounding the baby helps build immunity and protect her from germs and stuff like that. And then the last section is in case of an emergency, I would like my husband to be with me during the transfer and to be with the baby at all times. I would also like to be informed and provide adequate information for anything that's not listed on my birth plan. I don't want them to do anything without my permission. And then if I do end up having to get a cesarean or a C-section, I would like skin-to-skin contact still. You can still request that. Yes, they do have to put up the curtain, but they are more than capable of handing you the baby after she is taken from the womb. And then lastly, I would just like support and encouragement through this whole process. So basically, I just want to be encouraged, allowed to make decisions, informed, and not bossed around too much, because anything that causes outside stress during labor will slow it down and make it more difficult. So I just am looking forward to making this process as smooth and as simple as possible. So I hope you found that helpful. If you're interested in finding out more about birth plans or my birth plan, I'd be happy to send it to you. Just shoot me a message. But everything needs to be unique to you and your situation. What you feel comfortable doing. Maybe you don't feel comfortable with an unmedicated birth. That's okay, but that should be on your birth plan. So remember, you are in charge of your birth. No one else is, and it's not a procedure, it's a natural process. So keep that in mind. I hope you found this video helpful. If you have any questions, feel free to reach out, or if you have any suggestions for these last 4 weeks of my pregnancy, anything you'd like to hear or learn more about, let me know. But I'll talk to you guys in the next video. Thanks, bye.